We are actually evolving in surgery. 5 decades or 6 decades back, if someone develops cancer, no one had a thought to touch the patient. They will say, okay, he has developed cancer, he is going to die or she is going to die. So that was a stage of nihilism. But with the improvement in anesthesia and surgical understanding, these parts can be removed safely without causing death of the patient. Then came the era of radicality. What does radicality means? So at that period, surgeons were like, okay, a portion has developed cancer, I have to remove that portion along with a small portion of surrounding so that cancer doesn't come back. It took some time for us to understand that cancer is a systemic disease, which means when it has grown beyond certain stage, it would have already spread throughout the body microscopically. Not just removing the organ from which the cancer developed, it's not going to cure him. But at that period, maybe 30, 40 years back, surgeons were very aggressive. They used to remove lots of portion just to remove a cancer tissue. But that led to what is called as cancer-free survival, but their quality of life was a suffering. So they used to remove a portion of their face. They used to remove a fold of pancreas. They used to remove a whole of large intestine, and they were ending with a permanent stoma through which the motion comes through the abdominal wall and all those things. Now, we are in an era of quality of life. So, cancer surgeons these days are radical but at the same time conservative. So, this is an oxymoron. What is radical but conservative? Radical means I have to remove the cancer tissue completely along with a small surrounding tissue, but conservative means I have to preserve the function of the patient so that even after surgery for cancer, patient enjoys a decent quality of life. And that is where robo has got an important function. So, I take rectal cancer as one of the examples for robotic surgery's advantage. So, rectal cancer, it has to be removed completely with the fat and lymph node tissues surrounding the rectum. So, rectum is the last portion of the large intestine. Now, what is the advantage of using robo? We are not going to leave any cancer tissue behind, but at the same time, there are important nerves which supply both genital and urinary functions which are surrounding this rectum. Now, in open surgery and laparoscopic surgery, there will be some clarity, but invariably there will be some damage to the nerves supplying the urogenital organs. But in robo, we have got 10 times enlarged vision, which preserves. It's a function preserving surgery. We are able to visualize the nerves, we are able to preserve its function so that even after a radical surgery for cancer rectum, patient used to have a very good urogenital function. Second thing, when cancer used to come lower down, initially we used to do something called as permanent stoma. Cut off the anus, put the patient on stoma, but these days with advancement in chemotherapy, radiotherapy and robotic surgeries, we are able to go as low as a part of anus. It is called as intersphincteric resection. We used to remove a part of anus and then join the large intestine with the remaining anus and then establish a perinatural outflow. So still we are able to maintain passing per annum. So function preserving surgeries are the word these days, and robotic surgery has got a very important role in function preserving cancer surgeries. So in the quality of era, robotic surgery has got a very important role, and it is going to increase in the near future. So in case of any cancer surgeries, if doctor is suggesting robotic surgery, definitely it is with the mind of improving one's function, at the same time not compromising in the removal of the cancer. So that's the advantage of robotic surgery in terms of quality of life.